attending tonight's webinar, Fortifying Innate Immune Competence. Our sponsors for this evening are CareWell and Protect Wellness. At CareWell, we provide practitioners with custom online store options to help increase supplement sales. We provide practitioners with free online dispensaries, or we plug into the back of their existing e-com to help with the distribution. We also help with private label fulfillment, practice marketing, and provide educational support through our events platform. I would like to introduce our speaker for this evening, Dr. Mark Menolascino. He's the medical director of the Meno Clinic Center for Functional Medicine, which is located in Wilson, Wyoming. He has over 35 years of healthcare experience, and he has completed medical school at the University of Nebraska Medical Center, then completed internal medicine specialist training at Banner Health, Arizona. He is one of the very few physicians that is board certified as an internal medicine specialist, board certified in holistic medicine, as well as board certified in advanced hormone management and anti-aging medicine. He is one of the most brilliant speakers and practitioners I have ever met, and one of my favorite people on the planet. It is my pleasure to introduce to you Dr. Mark Menolascino.
Thank you, Kate, and thank you, Michelle. It's a pleasure to be here and to share some ideas and thoughts. And, you know, we're all a team in this, and it's such a pleasure to be able to be part of the team for you. It's a crazy time for everybody, and I feel like out of chaos comes opportunity, and it's an opportunity to help people. There's a motivation right now that I've never seen in my clients and in people who've never heard of integrative medicine, functional medicine, let alone nutrition. So what we're going to talk about today is we're going to do a deep dive in the immune system. And what you're going to find is that the notes that will be shared with you have references that are the sentinel articles in, for example, vitamin D and viral infections, in the immune innate response. And I think you're going to find the information that I'll share with you will be both scientific, but I want to leave you with some pearls that you can use tomorrow in your clinic. That's one of my passions, is to help you be successful, because we need more of this medicine out there. And I'm finding my phone's ringing off the hook because people are looking for lifestyle medicine, functional medicine, integrated medicine. So it is just a crazy time for everybody. And Michelle had mentioned that the top right picture of the baseball game with the virtual people, that may be the time cover of the year. Everybody's watching in the lower section of the data of the testing and the map from Johns Hopkins. At the bottom line is you just need to wash your hands several times a day and practice good behavior. What I'm telling my clients is that I can't prevent someone from sneezing on you. But if we do things right and focus on your lifestyle and your choices, we may prevent you from ending up in the hospital or in the ICU or on a ventilator. So I kind of think of people that have buckets of inflammation. And if your inflammation bucket is full, these type of viruses, whether it's a coronavirus, an Epstein-Barr virus, or dengue fever, it's going to knock you off your feet. If your bucket of inflammation is empty, you can tolerate some of this additional inflammation that these infections bring. And really, as we all know, inflammation is the root of all health evil. We really need to be able to deal with it. As this all took off, and really for all of us, it becomes a practitioner's conundrum. It's difficult to find adequate doses, and everything kind of dried up. In the package I was using, we had 6 different supplements, and I couldn't get 2 of them. And it was very difficult for a lot of my colleagues to maintain the supply that they needed, and it became really a worldwide issue. I heard something about the world supply of echinacea and some of these herbs is gone, and it's going to take years for it to replenish. Now, that may be a little bit of hyperbole, but this really was a problem this spring, trying to get what we needed. And this is what led me to what I want to share with you today. All of these single agents that markedly can increase the cost to you and your clients, the number of capsules that people have to take per day. And what I kind of like to think about with supplements is it's easy to keep stacking supplements on because they're all just another good idea. But at the end of the day, someone has to take all those, and it becomes very difficult. The non-compliance then becomes an issue. You just can't get people to take so many. So you have to really use a rifle. And we talk about you can't do shotgun medicine, and there is no silver bullet, but we talk about silver buckshot. So you really make your choices and you use this rifle approach, but try to cover all your bases. And then when you get sick, you need a boost. You need to supercharge that immune system. And there was a big question about this idea with the viral immunity, that when you take some of these herbal supports and herbal supplements, that you're over antagonizing the immune system and making people vulnerable for this dreaded cytokine storm. Well, here's what you're looking at. And this may be the money slide of immunology right now, is how a virus becomes a pathogenic, how the immunity gets built once it activates the macrophages and dendritic cells, creates this cytokine flood. You then go to the lymph node with your dendritic cell. It has the MHC class 2 there in the middle, which I like to think of what your immune system does. It has the natural killer cells, the neutrophils, the dendritic cells. And what they all are these surveillors for you. They find these bad pieces of bugs, the dreaded DAMPs and PAMPs you see in the top middle. If you ever heard Robert Roundtree speak, he does it very elegantly, talking about these damage-associated proteins, these pathogenic associated proteins. But at the end of the day, it goes to the lymph node where it presents this piece of the virus to the immune system to start teaching it what to do. And that's where the secondary effect of the T cells, cytokines, and inducers happens. And this is where the cytokine storm really takes off. The concept with these supplements is that they don't overactivate the immune system, they modulate it. So if it needs to be boosted up, they will do that. If it needs to be tamped down, they can help rein it in. So a lot of my clients had felt that some of these nutrients that we're going to talk about would overactivate their immune system and make them vulnerable, when in actuality what it does, it modulates it. It boosts what you need, but it dampens down what you don't, so it doesn't over respond. And this concept of these pieces of virus going through this process of the immune system and presenting it on the MHC platter for recognition and secondary effect is really the key to all of the immune system's effect. When I did my master's degree 30 years ago, we didn't really understand this. Now it's mapped out very elegantly, and this review does a great job of it. And this slide really lays it out as far as how we want to try to understand this. Viral sepsis. I'm an internal medicine specialist. I used to run the ICU when I was in Phoenix, and I was there in 2002 when SARS hit. And I was doing 36-hour shifts, and I remember pulling up to the 12-story hospital building. The 2 top floors were ICUs, and looking up there and wondering what helicopter was going to bring what patient that day, and I had to take care of them and go home to my kids. So for all of those on the front lines, my heart and thoughts go out to you and appreciation. This is big time medicine. It's sick people coming into these intensive care units, and they're very complicated because there's very diverse presentations. The reality is that if your immune system is diminished, if your inflammation is high, you're going to be vulnerable. So sepsis is this collapse of the blood pressure system, of the arteries, this dumping of cytokines and other chemicals into the organs, the third spacing or release of fluids into the non-cellular spaces. And this is what causes people to die from viruses. Again, whether it's the flu, dengue fever, or a coronavirus. So it's really the same mechanism. Clinically, it all ends up at the same spot. And once someone is sick enough to be in sepsis or ventilator, your chances of reversing that are about 1 in 20. Maybe it's a 95% death toll. So the normal immune response, it clears it and develops memory. But in sepsis, it overactivates. You get this dumping of all of these, incredible viral replication and immune exhaustion. Backing up, you know what? Why do kids get fevers at night? Well, we think that cortisol, which kicks up in the daytime, comes down at night to let you sleep. It interacts with your immune system, and the immune system gets a little weak in the evening, and that's why kids will spike a fever. What does a virus do? What it does is it enters cells, and it does it with the ACE2 receptor now with this coronavirus. But a virus will enter a cell, take over its machinery, and make millions of copies of itself, then blow up the cell or lyse the cell and go spread to other cells. It's an ingenious pathogen, and the mechanism is exponential. Once it starts, it can take over the cell's machinery, and there's no stopping it. So this inappropriate response in viral replication causes the immune exhaustion you see in the lower right. Well, antibodies is something that we're making a big deal of, but how do you explain this to clients? Well, I like to use the Epstein-Barr or the monovirus. When someone that has mono sneezes on you, or you kiss someone who has mono, you get exposed to it. And within about a week, the IgM antibody becomes detectable. And then after several weeks, as you see on the graph, it disappears. That's the IgM in the dotted black. After 2 to 3 weeks, the IgG becomes apparent, and it typically will stay, like with Epstein-Barr, positive for the rest of your life. And you'll see a lot of clinicians who aren't savvy tell people they have mono or Epstein-Barr when they see an IgG positive. We think that high levels of IgG may actually look like an acute infection clinically, even though the IgM isn't present. There's also an IgA, that's the mucosal antibody. There's some theories that that's worth checking in people to see what's going on at the mucosal layer. And don't forget, when you're looking at IgG or IgM or IgA, you've got to know what the total body production is. This is missed in celiac disease all the time. They'll check the celiac markers, IgA, IgG, but the clients will have very low IgA, so they don't detect it. And I see this probably once a week, and people are told they don't have gluten sensitivity or celiac, but their IgA is not present. And what do we use to boost IgA? Colostrum in many people will be helpful for that. So again, what decides the outcome? How do we know who's going to get in trouble or who's not? And as beautiful as this diagram is, we're pretty naive if we think we have this whole thing mapped out. If you really want to get difficult in medicine, go into either immunology or genetics. If you really want to kill yourself, go into both of them, the immunogenetics. But how do we talk about genetics to patients? You know, you're not your grandparents, you're not even your parents. There's this new concept of epigenetics. You can turn on good genes and turn off bad genes by your choices. And where are your choices? They're at the end of your fork. So start with food. If you're eating fast food, sugary food, soda pop, your inflammation's rampant. That's why non-GMO organic food, eating whole food, not processed food, it just makes sense. So our clients get confused about this functional medicine, integrative medicine, holistic medicine. Here's how I share it with them. I worked with Dean Ornish 30 years ago. He talked about holistic medicine, treating the whole person. Then Andrew Weil talked about integrative medicine, using nutrition with good medical care. Now we're talking about this functional, precision, personalized root cause approach. And it's kind of like in cognitive decline. It's also in your immune health or your inflammation. Why would you look at just a virus marker? Why would you not look at your genetics, epigenetics, your nutrient deficiencies, your toxicities, your leaky gut and intestinal permeability? Why wouldn't you look at all of that to help make a decision of how to make it better? And so we don't want people to get sick. Our job is to boost their immune system, reduce their inflammation, so that if they do, they have a better chance of doing well. So what decides that outcome? Well, some people have inadequate immune response. The flu shot, if you're over 65, doesn't seem to work. The viral conversion of flu shots in people over 65 is very minimal. They don't really get a boost from it. Very, very young, up to age 9 months or so, your immune system is from your mother. That's why breastfeeding makes sense. That's why vaginal deliveries make sense, to help the flora of the child. People with HIV, genetic deficiencies, they affect the humoral and cellular responses. The immune system is very finicky, and it doesn't take much to throw it sideways. Think about all those people that are on chemotherapy. And don't forget, autoimmune disease, we're now using chemotherapy. These are monoclonal antibodies we're using. We're using methotrexate. And there's a lot of people that have undiagnosed underlying cancer. And one of the other real problems with what's happening this spring is a lot of people aren't undergoing their checks. So we're going to see a higher rate of cancer. But autoimmune disease, really, how do you explain that to clients? Well, your immune system, instead of being vigilant and kicking the butt out of coronavirus and other flu viruses and other bugs, it actually attacks yourself. What do we test for in lupus? A double-stranded DNA antibody. People with lupus are making antibodies against their DNA. What about rheumatoid arthritis? What's a rheumatoid factor? That's an IgM antibody that the body's making against itself. And so we talk about this molecular mimicry, that is there something in the body that is causing the stimulation? A toxin, whether it's a heavy metal, a tick-borne illness, mold, whether it's an issue with the body not being able to recognize other infections. Autoimmune disease is the body attacking itself. And so we have to be vigilant and detect these. And Hashimoto's, if you're not testing for it, you should be testing it in every single patient, particularly your female patients. And that just gets the whole discussion started. If you have one autoimmune disease, you're 5 times more likely to get another one. And women are 11 times more likely to have autoimmune disease than men. And why does it seem to be an epidemic? And it's our environment. It's the food we're eating, the toxins we're exposed to. Well, we also have these people who are overactive immune responders. People with asthma are particularly vulnerable right now, but asthma is really an inflammatory condition. It's not really a bronchospasm airway condition. That's the end result, but what's driving it? And we talk about autoimmune disease, the inflammasome activation. How do you describe this to patients? Well, we talk about mast cells. Those are one of your immune defenders. And they're little cells in your body with little teeny bags of a chemical called histamine. And when an allergen comes in, it tickles that cell, it drops these bags of histamine and they explode in the body. So you get congestion, runny nose, sneezing, cough, rashes on the skin. And so you can take an antihistamine drug to mop up the histamine. We're going to share with you in a moment some supplements that actually calm down the mast cell. So instead of exploding with histamine, it just kind of poofs with a little bit of it. And that can be a big issue in driving this whole inflammatory reaction. How about risk factors, comorbid conditions? We know that cancer, chronic kidney disease, lung disease, an immunocompromised with an organ transplant, or anyone that's on a medication that dings the immune system. Obesity. We have a negative 35 COVID club in our clinic. There's about 40 people in it so far. They've dropped 35 pounds since the spring. And they're serious about their health. They've made a huge change. I'm super proud of all and each one of them. That's what I want you to do, is recruit people out of your patient base, get them on a program to lose that body fat. Cardiovascular disease, and really not even serious cardiovascular disease. Many people have silent cardiovascular disease, and they just can't handle the stress of this immune challenge. Sickle cell disease, type 2 diabetes, I'm sure all of you know type 2 diabetes is reversible. And again, this is this window in our clinics where we have a captive audience that they're really fear-based right now. And I was taught in medical school to motivate clients by fear and guilt. I don't believe that. I think if you provide information to empower people with knowledge to help them make good choices based on their belief systems and desires, people can do anything. And if you start with that basis and tell them they're not doomed by their genetics or their parents and grandparents, they can change their epigenetics, you now have someone who can make a change. And anybody can. That's the beauty of it. And I know you guys all do it every day. It's a pleasure to see it. Well, what about these suspected risks? Everything on this list. Dementia is something we're not thinking about, but what do most people with dementia die of? They die of pneumonia. Steroids, these other H2 blockers for digestion. There's a lot of medications out there we're going to look at, but any of these are risk factors, and anything with the lung. I really feel like smoking is the one thing I just don't understand. And that's the one thing that in my clinic, you can't be in my clinic as a client if you smoke. And actually, what I tell my clients, particularly the women, If you go to Beverly Hills and want plastic surgery and you're smoking, the Beverly Hills plastic surgeon will not take you to surgery until you quit because they know you're not going to heal as well. Well, if you're that worried about your skin, maybe you should be that worried about your lungs and your heart. So again, we don't let people in our clinic unless they're actively trying to quit, and we have tools to help them. I'm an internal medicine specialist. I ran the ICU. I believe in medications when they're needed. So the allopathic model of medicine is fantastic for acute care. It fails woefully for chronic illness. Type 2 diabetes, as we mentioned, we reverse it every day here. But when we give medications, you start on one medicine for type 2 diabetes, pretty soon you're on 2, then you're on 3, then you're on insulin. But what do we know about all of these medications? They're depleters. Everybody knows about statins and CoQ10. Most people know about metformin for diabetes and B12, but I don't see the primary care doctors looking for either one of these. The H2 blockers and PPIs, I think they probably will get banned eventually. They deplete almost every nutrient. I've seen probably 100 clients with iron deficiency from their acid blocking medicines, and they're worked up for anemia, and no one thinks that it could be their medication doing it. And most of my diabetic patients are low in B12, and they feel a ton better when they have the methylcobalamin. Aspirin even can affect these, but don't forget about the medications your clients are on and look at their nutrients and support them. Well, what about the infectious response? Prevention, prevention, prevention. That's what we all have to do. Wash your hands, all of the things that we do, but really these should just be basic behavior that everybody does. Because there were, in the spring of 2020 and summer 2020, we're worried about this coronavirus, but there's viruses all around us. The flu comes every year. Sometimes it's a little worse than other years, but it's there every year. So practice it yourself, teach your partner to do it, teach your kids to do it. And what I'm really seeing is, as hard as it is for kids right now, they're understanding the value of nutrition, the value of social support, and they're seeing what they're missing. And I really feel that it's this next generation. My daughter's 18, she's going into medicine. It's really her and her friends that are foodies and are concerned about our environment and about each other. And it's really a beautiful thing to see. So prevention, prevention, prevention. We can't help people from getting sneezed on, but if we use our tools and provide them with a plan that we're going to share with you in a moment, you can actually affect the trajectory of what happens to them. We talked about the viral replication. Once it starts, it's a wildfire. It takes over the cellular machinery, and then your outcome is inflammation. And really, all of the things I was taught in internal medicine, I can tie back to inflammation. You know, really in medicine, we have all these itises. We have dermatitis, gastritis, esophagitis, prostatitis, sinusitis, myocarditis, cerebritis. We have all these itises, so we have all these ologists to treat them. We have neurologists, gastroenterologists, dermatologists, but really at the core root cause, functional integrative model, it's all the same thing. But 10 people come in with a problem, they all have 10 different paths. So think about irritable bowel syndrome. I don't think it exists. Syndromes are things that we put a cluster of symptoms together to give a client a label to get them out of the office with a condition and an ICD-10 to code for. But do we actually have anything to treat them with? So really look at the root cause. And 10 people who come see me for IBS, they have 10 different paths that they got there. But none of them leave with that diagnosis because we look for the root cause. As we say in functional medicine, go with the gut to treat your inflammation. And resolution. You have these phases that people will go through. And part of the key is these supportive nutrients. You know, the USDA did a study looking at nutrient levels in Americans. Magnesium, 63% deficiency in the USA, all comers. So we know that most of us are depleted nutrients. We just looked at the medication list. The average 65-year-old man is on 4 medications. And so how many nutrient deficiencies does he have? I get 30 journals a month. I read them all cover to cover. The first coronavirus article was in New England Journal of Medicine in January by Dr. Fauci, not your regular coronavirus. Now the cover of New England Journal of Medicine, 3/4 of the articles are on the coronavirus, and our knowledge base is just exploding. And it's a very interesting bug and the way the body responds to it. And I do feel that the nutrients you support with the body are the key to going down one path to the other. We're going to talk about each one of these. They're all well known to you. Melatonin is one that I've been pleasantly surprised by. I'd heard an Italian doctor talking about it 20 years ago, using it for stroke, using it for heart attack because of its anti-inflammatory properties, something you don't regularly think of. But all of these have a place. Let's talk about vitamin A. So remember, what are the fat-soluble vitamins? A, D, E, and K. Those are the ones you get in trouble with. I saw 2 people in residency with vitamin A toxicity. They went into liver failure, needed a liver transplant. But we're talking about hundreds and hundreds of thousands of units per day of vitamin A. Vitamin A, when used in the right way, is very, very safe. Unless someone has advanced cirrhosis, most people can tolerate vitamin A at good dosing levels to make a difference. The Th1, Th2, that's the T cell balance of your cytokines. We talk about that in Hashimoto's. Datis Karazian did a fantastic book on this, looking at this balance with the thyroid. That's one of the best books that are out there. He's one of the best clinicians in inflammatory processes for the nervous system. And we look at this Th1, Th2 balance. We want to inhibit the ones that push Th1 and enhance the ones with Th2. And again, enhance and modulate to me are the same things. It's optimal production and optimal protection with these enhancing the cytokines. Nitric oxide is one of the forgotten things in nutrition and medicine. Most people are low in nitric oxide. And a pearl for you clinicians, when you see someone do a cardiac stress test and their blood pressure at the beginning is 120/80, at the end of their stress test, their blood pressure is 220/110. I call that stiff pipe syndrome. Those are people who have very poor nitric oxide production. Their blood vessels aren't elastic. They can't handle the stress of exercise. So when they go out to dinner and have that steak, they'll get chest pain. And I've had people call me from their car after dinner, had a big steak and having chest pain. And those are people with stiff pipes. So nitric oxide really helps to favor the blood flow for the body in the right way. And again, modulation, not overstimulation. You want to enhance IL-1, interleukins. IL stands for interleukin. When I did my master's, there was 6 of them. Now there's, I think it's up to 45 or 50. They're expanding every day. And you can test your interleukins. You can test your cytokines. They're very expensive, very finicky tests. I used to do them on patients, and it kind of got me in the weeds, so I don't do cytokine testing anymore. Really, a CRP will tell you what you need to know about the immune system. It's not a perfect test, but I screen everybody right now with the CRP, and the people that are high, it just starts me down this anti-inflammatory path. There's something going somewhere. And when you see a high CRP in an otherwise healthy person, you've got to think about cancer, because CRP will be high in undiagnosed cancer. Looking at the non-inflammatory environment, this viral RNA in the cytoplasm, and it upregulates the interferon-stimulated gene. So a nutrient is an epigenetic modifier. And all these really are. They're working at the cellular level. How do we know that genes make a difference? How do we know you can modulate them? There's some beautiful work by Dean Ornish. Yes, he's the guy that got me to go into medicine. Instead of getting your chest cracked open and the legs, your veins from your leg replumbing your heart, he did nutrition, exercise, stress management, and social support. His group did better than the people who had cardiac bypass surgery. So we know that these models work. So what did he focus on next? Prostate cancer. So he did a genetic imprint of what people's epigenetics were, what their SNP production was, and then he treated them with his nutrition lifestyle program and redid the test. And essentially it goes from red, active, bad genes overexpressed to green, active, good genes expressed just by nutrition lifestyle changes. So this isn't my opinion. This isn't a Alternative medicine theory, this is proven in science. We know that this works. So homeostasis, what a beautiful word. Tolerance, what another beautiful word. What we're all looking for, really individually, socially, is a balance, a homeostasis, and a tolerance. So we're gonna get sneezed on, we're gonna get a bug bite, we're gonna get these exposures, but what we want is our body to be able to go back into this balance and have the buffer or the reserve that it can tolerate it. And in the steady state, all of these work together. Your dendritic cells, your macrophages, I call them the three warriors, you know, they're part of the three warriors with your T cells. They sit there and they're your protection mechanisms. And what do we know about these cells? When people are depressed, their activity is dysfunctional. So we know that mood is directly tied to the cellular recognition of these immune cells and their cytokine expression. So in inflammation, you have an overexpression of this. The macrophage actually becomes gas on the fire. You get a completely different set of interleukins, the ILs that you see there, and you want it to be a protection against the infection and tissue damage. It's all a balance. This slide from 2014 is now completely not valid. It's about 10 times this more complicated, and that's where the immune system is going. It is exploding with knowledge. One of the good outcomes that's going to be beneficial for all of us with what's happening right now is the attention to the immune system. We're going to learn so much, and everyone in the world is working together in a way they never have, that we should really be benefited from our long-term knowledge of the immune system, how to help it, how to protect people. Vitamin C, big controversy in a lot of people, not in my clinic. Vitamin C is one of the easy things to do. My father was a world's expert in Down syndrome. He did a residency in California. He met a guy named Linus Pauling, had dinner with him. He ate 6 grams of vitamin C at dinner. So I went home back to Nebraska and I tried that. I had diarrhea instantly from 6 grams of vitamin C. So vitamin C can, like all of these nutrients, there's too much is not a good thing. None of it's a good thing. There's a balance for it that you have to have, and it becomes a quality issue. Vitamin C is not vitamin C, the source of your C. And that's why you want to look for regulatory bodies on the supplements you do. Not go to your grocery store and get things, but get them from a source that you can trust, someone who's done their homework looking at them. What do you know about vitamin C? The first thing the cells do when they are attacked by a coronavirus is their vitamin C levels drop. It supports the innate, which is your built-in, as well as the adaptive, which is the learned immune system. It protects the healthy cells. It upregulates the ability of chemicals to go where they need, for these cytokines to go where they're needed in the body so the immune system can do its job. Again, you want a rifle, not a shotgun, and it helps them to sight in. It's like a rifle scope for your body. The T cells and B cells, that's the relationship. And then the natural killer cells are your first line of defense. IL-12 is the interleukin you want. And again, IL-6, TNF alpha, those are the inflammatory cytokines. If you take anything away from cytokines, the two you have to know about are IL-6 and TNF alpha. Those are the bad guys. Those are the pro-inflammatory cytokines. Viral replication is dampened down by vitamin C. It helps other antioxidants, the tocopherols and tetrahydrobiopterins, and it prevents systemic and respiratory infection. The data is pretty clear in both our oral and IV. Now, it's not universal. And one thing I'd like to share with you is that, you know, I was going to go into academic medicine, and then I did clinical trials, and I got a little disillusioned with it. Mostly only positive trials are published. Negative trials typically aren't, but it's very difficult to take something like vitamin C and do a clinical trial. A double-blind, placebo-controlled, multi-center international meta-analysis probably won't happen to know the benefits of vitamin C, but there's an intuition that we need to use with support from the evidence, but really the evidence is there. As we look at all of these nutrients we're going to talk about today, you can find it. And again, in the notes section, which we'll share with you, all of these Sentinel articles are available for you. You should get them, download all of them, and keep a file folder for them and read every single one of them. Then use those as your evidence base. The data is out there. The evidence to support what you're doing is there. And I got to tell you, 35 years of healthcare experience, I see it work. And now today, I'm seeing it work even better. So we talk about the respiratory infection. It does prevent and actually treats respiratory and systemic infection. It's about prevention, replication, inflammation, and resolution. You've really got to address all of these. You can't just jump in and fix inflammation without slowing down viral replication. And at the end of the day, you want it to resolve, but we want to leave our clients in a prevention physical stasis mode as well as a mindset. Vitamin D, well, if you read the latest internal medicine articles, they say vitamin D doesn't work. The level doesn't really matter. Anything over 20 is okay. Well, I'm going to tell you, vitamin D, what I see clinically is a game changer. My levels, I like to see in between 70 and 90 nanograms per deciliter. Every lab has a different range that they have, because you've got to look when you're comparing vitamin D levels in different laboratories. They may have different ranges that they use based on the concentration or the value that they test. So vitamin D, and what I tell my clients, vitamin D is not a vitamin. It's a steroid hormone. It goes right to the nucleus and works with the calicins. It works at the immune system DNA level to regulate your immune system, to suppress the inflammatory system. There's your interferon gamma, your IL-2, your TNF alpha, the bad players in the cytokines for inflammation, and then your anti-inflammatory cytokines, IL-10 being my favorite. NF-kappa B, vitamin D, it's very clear that working through the receptors, stimulating NF-kB, it modulates it. And what it does is it reduces your pro-inflammatory cytokines by binding up to the NF-kappa B subunits. You want to reduce it by stimulating the production of the binders that grab the NF-kappa B and reduce your inflammation. The cathalicins are the key to this by being upregulated with vitamin D, and that's the player that works in the cell to reduce the inflammation through the NF-kappa B. So there'll be a quiz on this slide in a few minutes, but again, I hope what you find in the slide deck is this is great information. It's references for you. It's information in the notes. Once you master this slide, then you can come work in my clinic, because I can't figure it out. But it is this complicated. And all of these different illnesses like hepatitis C, like HIV, they all affect different aspects of this, shown in the different steps that you see. But looking in the middle right, what do we see? Mitochondrial membrane. I really feel that the mitochondria are the key to so much of our health. Go back to that list of medications, the ones that affect your mitochondria. You can now map out, remember that thing called the Krebs cycle you had to memorize in 8th grade biology? You can map it out in people. You can look to see where they have, as Bob Roundtree says, where do you have too much of something that's bad or not enough of something that's good? And that's why, again, with the supplements you're choosing, you need high quality, but you want to cover all of your bases to be sure that you have all of these different pathways supported, because the immune system needs all the support it can get with this. So zinc is very interesting because it supports both the innate and the adaptive. And so you get kind of a double whammy of it. Like a lot of supplements that we talked about, vitamin A, you got to be careful not to get too much. And so you have to go with a company that's making a product you can trust, that's been assayed, that's been analyzed, that has the good seals that you'll see, that you have to have those choices so you're protecting your patients. What about zinc? Well, if you get too much zinc, what happens? You deplete copper. So massive doses of zinc aren't good. It's the right balance. 30 to 60 milligrams seems to be a good choice. But zinc seems to be one of the players right now for the immune system, for specifically viral protection and support. You see low levels in people who are immunosuppressed, and in the people who have low zinc levels, as well as low vitamin D. When we do stimulation assays of their immune cells, they don't do anything. They just kind of sit there. And so the zinc is a protective as well as a modulator, and it prevents viral infections. The data is clear on that. It reduces not just the the occurrence of it, but really the severity and the duration. So do you want to get the flu and it kick your butt and be around for 3 weeks, or have it just kind of make you feel bad and be gone in a couple of days? That's where all these nutrients come in. This is where lifestyle medicine comes in. This is the work that Dean Ornish taught us. Eat food that's clean, work on your nutrition, work on your stress management techniques, develop social support and love in your life. And, I was talking to him about a year ago about all of this, and we're talking about the Mediterranean diet. What's the data on the Mediterranean diet? Reduces all-cause mortality 50%. Really? If we had a medicine that reduced your mortality by half, it'd be $1 billion drug. There isn't one. No such thing. But food can be. Now, Mediterranean diet, it's different in France and Spain and Greece and in the different parts of the Mediterranean. But what's the commonality of the Mediterranean diet? It's whole food, and it's eaten in a group social support setting, typically a family. So it might be that family love and connection that's as powerful as the food. So you can eat the best, cleanest organic food, but if you're sitting in your car eating it or being lonely and depressed by yourself, it may not have the immune boosting capability as eating it with someone that you care about and that cares about you, having some love at your table, even if it's your dog. But don't eat alone. Loneliness is one of the really drainers of your immune system. And loneliness, depression, immune deficiency suppression, that all goes hand in hand. And again, zinc is one of my favorites. The T and B cells, which are the communication of the body, the T cells are your first line defense, and they educate the B cells for your long-term protection. These immunologic memory, your immune system has a memory so that it can be protective for its secondary exposure. There's a real question with coronavirus, how long that lasts. And really, vaccine efficacy may be modulated by zinc, and people who have low levels, and we mentioned the elderly over 65 don't really have a great vaccine boost when they get the flu shot. It may be due to zinc deficiency. So this template binding with the SARS-CoV-2, it suppresses the viral attachment and replication. That's been shown in the test tube. We know that it does. And we're seeing zinc deficiency in a lot of my clients that have poor cytokine levels, that have autoimmune disease, that have inflammation. We're seeing these levels of zinc low, and we're checking zinc in every one of our patients. Again, you got to hit all 4 bases to get a home run. Quercetin, one of my favorite supplements. It's a bioflavonoid, so it's incredibly safe. It's essentially food, but what it does, it regulates your glutathione, and so it boosts your antioxidant capacity. The signal transduction, all that means is your cells communicating. And so I tell my clients, again, that mast cell, it helps reduce that explosion of histamine. So instead of mopping it up once it's exploded, go to the source and reduce the boost. And that's really what the key is. It also downregulates that NF-kappa B and TNF alpha, the bad cytokine in your macrophages, particularly in your lung cells. The cyclooxygenase and LOX pathways are part of that whole inflammatory cascade. You want to calm them down. We just talked about the mast cell stabilization. And you do see it protect the gut, as all bioflavonoids do. They do have a broad spectrum of antiviral properties, both rhino, adeno, and corona. And again, they all can be bad players. You're exposed to these every day. It's amazing that we're all not sick every single day, because these viruses hit you every time you go to the grocery store. They're out there, but who gets sick and who doesn't? And I'm proposing that it's that inflammatory bucket that makes a difference. If your immune system is weak, or if it's overinflamed, your body doesn't react appropriately. So 1,000 milligrams a day, reduce sick days, symptom severity. As an employer, this is something you can share with the businesses you work with. And clinically, if you're not marketing to businesses, you should be. You should approach the upper level management, get them on your program, and what you'll find is they then want to share it with their upper managers and their staff. We did this with cardiovascular disease. If an upper level manager has a heart attack, it causes the company $1 million. That's what the data shows. So you can boost the health of companies by supporting their nutrition, supporting their immune system, reducing their inflammation. Another slide you'll be quizzed on later. Again, the data is pretty clear. Quercetin's mapped out where it works on the reactive oxygen species, going down through the NRF2 pathway and affecting at the DNA level the antioxidant response complex to be sure that you're reducing inflammation. It's not a hypothesis. This has been mapped out. Astragalus, again, there's several nutrients that I think are key. And if you're giving your clients supplements and this isn't in them, you're definitely missing the boat. And we talked about that modulation earlier. You want to boost the immune system to be more effective and efficient, not overactive. And that's what these nutrients do. It helps these B lymphocytes and T lymphocytes, your immune system generals, to be the right ones and to be present, leading the troops and reducing the inflammation and dealing with infection. It's that balance and the regulating the warriors, the natural killer cells, the macrophages. Your dendritic cells and their antigen presenting capacity, this idea of presenting the platter to the B cells and the immune system so they can make the response that you need in an efficient, active way, reducing these other levels of bad cytokines, but not hurting the cell. So it's kind of like a fire, is you want the fire to be warm enough that it keeps you warm, but not burn your house down. And that's the key analogy I use with my clients about the immune system. Think about your fireplace and building the right size fire to be warm in the winter, not building it so high that it burns your house down. So it's really a modulating power to promote the cytokine production to enhance immunity. And really it's this inflammation response factors. You can definitely see astragalus in the test tube as well as clinically reducing the inflammation in clients. Well, you know, what is diabetes? I mean, if you want to put your body on fire, don't regulate your blood sugar. Have a bunch of extra sugar floating around in your body. What about people who don't even know they're diabetic? What's the first thing they get diagnosed with? Usually a urinary tract infection. Out of the blue, they'll get a UTI, and then they'll say, you know, I've been urinating all the time, and that's the sugar causing the osmotic gradient in the urine. But it also becomes a breeding ground for bacteria. It's also a breeding ground for viruses. So if you really want to get the butt kicked by a bacteria or virus, have a bunch of sugar in your blood. It really is gas on the fire. So astragalus helps the insulin resistance. It affects the islet beta cells. What did Jeff Bland talk about at his symposium last year? Exercise increases the production of beta cells, the islet beta cells, for optimal insulin production. But it's not just making enough insulin, it's the cell being able to recognizing it, opening the glucose transporter to let the blood sugar in. It's a very complicated mechanism, but you want to have all aspects of it covered, and your zinc, your vitamin D, your astragalus, all of these work in concert to help your blood sugar be optimal. Melatonin, I mentioned earlier, you know, we all think about it with sleep. I kind of see this being as one of the secret weapons for the immune system because of its anti-inflammatory properties, and it works directly on the TNF alpha. Prostaglandins are the other chemical that you want to reduce through that cyclooxygenase pathway. You know, we had drugs that reduced COX-2, the COX-2 inhibitors. That was Vioxx that got taken off the market. All NSAIDs do it. There was a question about NSAIDs with coronavirus that didn't really bear out in the data that it was an independent risk factor. But what do we know about NSAIDs? They affect these cyclooxygenase pathways. They affect leaky gut. And so they tend to be not good drugs for several parts of the body. And then we looked earlier at the nutrient deficiencies that you see with the NSAIDs. So really use the natural NSAIDs, the natural nutrients that reduce inflammation. And what's your first choice? It's at the end of your fork. It's food. Pick anti-inflammatory food. You know, what do we know about nightshades? Nightshades is one of the pleasant surprises that my naturopath friends, who most of them are smarter than I am, that for the right person, going off the nightshades can be a game changer, but not everybody. So I've seen people stop tomatoes and their joint pain go away and they never need an ibuprofen again. So it's really interesting how these food is medicine. We know this, and my dream is to have a naturopath working in my office and have a chiropractor and have a health coach and a nutritionist and an exercise physiologist and be this team. Remember, guys, there's no ego here. Whether you're a MD, DO, DC, ND, we're all on the same team. Getting healthy is a team sport. So work in your community, put these resources together, build your team, get people that are like-minded that want to support each other, either in person or virtually. It's too expensive to put them all in a brick and mortar place, but you can do it virtually, you can do it relationship-wise, and you have a lot of great information to share with them. Maybe you offer them a complimentary consult. That's a great way to get started. A little tangent here just to talk about marketing for a minute. Should you pay for TV ads and pay for radio ads? No. You should make yourself known to your radio stations, TV stations as an expert, because you are. You've spent your life learning about all this. If you've been to any IFM conference, you've got a step ahead of every primary care doctor out there. They want to hear your messaging. Go to your local Rotary Club, go to even your hospital foundations, but go to these groups that are dying to have good speakers. And right now they want to hear this. This is a message they all want to hear and need to hear. EGCG, the key that I think we miss a lot, I don't use it much, and now I am with this package. It really is not just anti-inflammatory or antioxidative, but it's anti-proliferative, antibacterial, antiviral, anti-tumorigenic. There's some great data. Chinese medicine knew things a lot more than we did, and really it's this T-cell activation. So it really is an immune surveiller, and it kind of is your commander of the immune system to look for cells. You know, really, what is cancer? You have cancer cells being formed every single moment, but your immune system in its surveillance mode goes and finds them. So what do you want your immune system to be? You want it to be razor sharp so that if you have cancer sneaking up, it kicks its butt. But you also want it to be hypervigilant for these viruses that are getting there. So the immune system really is the key to having this balance between being active and razor sharp when you need it, but not overreactive and uncontrolled. And all of this works together. And I don't think you can get all this just from food. I'd love to say that you can. You can go to your local organic grocery, you can go to your farmer's market, and you absolutely should and support those people. I do all the time. That's how I get my food. But I do think in these type of times, with the stress, especially that's happening with everybody, stress is such a sneaky effect that you really do need these additional nutrients. The viral immune support, again, the EGCG works really at the nucleus level for protein expression. The data is pretty clear. N-acetylcysteine, I used to use a lot of glutathione. Now I'm really using N-acetylcysteine. That really it decreases the viscosity of the sputum. We used to do glutathione nebulizers, which was very interesting. And for some of my asthma patients, that would reduce their intensity of their asthma attacks and their frequency. Well, it's really about the sulfhydryl groups. And most of our food is sulfur depleted, with the sulfur being low, and you need sulfur in your diet to help your glutathione be optimal. A much less expensive way is to use N-acetylcysteine. It's bioavailable. And there's some question about in the gut, is it optimally available? Well, IV glutathione would be better than anything probably, but it's expensive. You can have reactions to it, and it's not possible to give everybody IVs right now. So look for clean, good bioavailable supplements that are in a balance and in a way that you can provide a daily support for people, but also give them a secret weapon. If they feel something coming, they can boost it immediately. Hospitalization days have been lowered in people with COPD, and for your clients with lung issues like pulmonary disease, like 20, 30, 40 years of pack years of smoking history, you really do need these good antioxidants. This is one of the best articles I've seen. Again, all the articles in the notes, please go to them, please download them. Well, we're back to the conundrum. How do you find adequate doses? And once you do, how do you keep it flowing? If you do it all in single agents, it's very difficult to do. You've got to get them all shipped in. You've got to have this huge inventory in your office. It's just impossible to do. So you don't want to be giving 15 capsules from 5 different companies and 5 different bottles. You want to find something that's easy that people can be compliant in. Who's the worst compliance? It's female OBGYN residents taking their birth control. It's the highest rate of non-compliance that's ever been recorded. Even doctors don't take their medicines right. So you've got to make it packaged in a way that people will do it. And when they get sick, there's something about the mindset. Dave Rakel, who spoke at IFM and integrative, the holistic medicine conferences, he did studies on placebo. When you have a jerk, not nice resident go into someone with bronchitis and give them an antibiotic, they're sick on average 3 to 4 days longer than when you have a nice person go in that connects with the patient, looks in their eye, gives them some compassion. So there is something about the placebo, but there's not just placebo. You've got to have compliance. So it's about looking at the right nutrients with the right type of program. And when people get sick, if they know they have a secret weapon in their pocket, that reduces their stress, their anxiety, their cytokine levels, their inflammation. So it brings us to the ultra-immune defense system, protectwellness.com. It's a daily defense, then a daytime and bedtime boost when you get sick. It's packaged in a box. This has been a game changer. And my first question when I look at any supplement is quality. I tell my clients, grocery store stuff, no one knows what is in it. Health food store stuff is a little better, but you got to have something that has the NSF, GMP. And the Australians take this very seriously. If it passes their Department of Health, it's safe. And so you want to look for something that has this quality. This is an extension of you when you make recommendations. You've got to do pharmaceutical medical grade. Protectwellness.com. Again, when you feel good, you want something for everyday protection, but when you start getting a fever, a cough, headache, nausea, all the symptoms we talked about, you want the boost, both daytime and bedtime. Throw a little melatonin at bedtime and sleep better. Again, a 3-step immune support. You've got all the ones we talked about in active, bioactive levels. The daytime boost, the bedtime boost. There's your melatonin, elderberry, quercetin, and NAC. This supplement program is equal to taking this much food. 2 pounds of elderberries. I have elderberry jam. That's what I use for my elderberries. But 2 pounds, 7 cups of lentils, 22 carrots, 13 salmon fillets. What would this food cost your client to do if they could even find it? And most of it that they find isn't even good for them because it's not clean food. So turn to the ultra-immune defense system. It's got everything that you need in your daily defense for maintenance, then your boost when you need it. So again, it's hard to find doses you need. The single agents doesn't work. It's too many capsules. Compliance is a problem when you've got 6 different bottles, and it's great psychologically, emotionally, physically, physiologically, when people have something, they get sick and it boosts them up. It's just 2 tablets a day. That's your prevention. Then you have your daytime and bedtime boost. It's immediate access for these acute challenges, and it's incredibly reasonable for your clients. That's a bargain to have this secret weapon in their pocket. People love it. It's easy. It's easy to do. It's easy to carry. It's easy to market. And I just want to tell you about Carewell. I had an in-store pharmacy here with my supplements. We were sending 30 to 40 boxes out of the office a day. I met Ivalo and Kate, and guys, I've probably known them 10 years. They do it better than anybody else, and they've made my life incredibly easy. They stock all my supplements. We have an online store. And if I can help anybody move that direction, get your online store done, put out some good content. You can steal some of mine. Anything I have, you're welcome to borrow. Just pull off my logo, put yours on it. You're welcome to use it. As JJ Virgin says, we're all in the same boat. The rising tide lifts all boats here. I'm here to be available for you. Anything I have is yours. Let's help each other, and it's a team sport. Kate, if I may, I'm going to pass it back to you, and we'll take a few questions.
Of course. Thanks so much, Dr. Menolascino. Now, we do have quite a few questions coming in, so we may not have a chance to get to them all, but we will start with a few of them. First question is, some of my staff members and patients are afraid to come into the office due to COVID. How can I make them feel safe to come back? What conversations are you having?
Well, there's several different groups. IFM has done it. Virtual Practice has done it. That, you really have to follow the guidelines. In our practice, we check everybody before they come in, their temperature, their pulse oximetry, their heart rate. We have a screening questionnaire of symptoms that they've had, whether they've been around someone who's been sick or tested positive. We have a plexiglass shield at the front desk for people to come in so that they protect the staff. There's set guidelines that you need to do. The CDC has them out, but several groups have done it as well. And you've got to protect your staff. It's very scary for people coming to work, whether you're a restaurant employee, whether you're a grocery store employee, or you're working in a clinic. So the first is just to communicate. And then second is have these set strategies that everybody follows so that you can detect people who are sick. You can't get everybody, but we're all going to get exposed at some point probably to this virus. It's just protecting the people around you, your family and your teams.
Fantastic. Next question, actually, there's quite a few back-to-back about testing. What test do you use to measure zinc? Do you check serum zinc or RBC zinc? And what company's test do you use to measure vitamins A, C, D, zinc, or do you use a panel?
Well, there's a lot of great companies out there. The Cleveland Heart Lab has been one of my favorites. They're now partnered with Quest. I do use a lab called Access Medical Labs out of Florida. We have a nasal PCR that's usually a 2-day turnaround. You've got to find what you like. I'll caution everybody, there's a lot of testing that's come out of China that's not been validated. So your sensitivity, specificity, how do they determine that? Number one, what is it? Number two, how do they determine it? There's a lot of money in testing right now. The antibody test, if you go to my website, mentalclinic.com, you'll see my test. I did an antibody test. I was in Eastern Europe working in January. I came back super sick. I was sure I had it, but my antibodies are negative. Did I actually have it? I kind of tell people, if you have a negative test, you can probably trust it. If you have a positive test, you may not be able to. And there's the predictive value. In July, if you have a fever, you probably don't have the flu. In January, if you have a fever, you probably do. So it's the predictive value. If you're asymptomatic and you're positive, you may or may not be. I don't think we've sorted it out. There is no perfect test. I think you look in your community, what's available, but don't jump on the bandwagon to get these tests that haven't been proven, because there's a lot of unproven tests out there.
Fantastic. Next question is, with all of the various options that appear to be out there at the moment to boost immunity, how can we feel confident that this product is safe, and how can this benefit my patients and my practice?
Well, it's a great question. And I'm an MD physician. My license and my reputation on the line for anything I recommend. I wouldn't be here if I didn't believe in this, if I didn't believe in Carewell and believe in the product. And I turn to the governing bodies. If the NSF and the Australians think it's safe, I'm pretty confident it's safe. The data I just shared with you about the nutrients, it's overwhelmingly supportive of using these. So you're never going to find the perfect secret weapon. This is as close to one that I've found in its ease of use, in its patient compliance, in the cocktail that it's put together, and the quality that it is. It's the perfect storm for this storm. It's a perfect answer.
Awesome. So there's a few people that have asked, what is your website? So for everybody, it's www.menoclinic.com. And then next one is specifically for zinc. What do you test? How do you test for zinc?
For magnesium, zinc, folate, the RBC, magnesium, folate, zinc are more accurate. There are advanced micronutrient tests. Vibrant has a good one. SpectraCell's good. They all use different technology. I find them to be a little pricey. And so when you're doing nutrient testing, you have to find one that's reasonable. I like Vibrant's micronutrient right now. It's easy to do. They're doing a good job. But my message with labs is, unfortunately, we can't go to conferences now, but when you do, you go meet the labs, you find people you like, that you trust, let them teach you. But find a lab that your friends are using. I'm happy to share with you the ones I use, and get comfortable with them and know, again, there are weaknesses. There's no perfect lab, but there's ones that are doing a good job, and they're in the space that we live in. They're supportive of functional integrative medicine, so I want to support them.
Fantastic. And the last question that we'll ask for this evening, and there are a few more lingering, we will be responding to those questions via email. The last one is, so my patients take the green bottle daily and then add the other 2 when they're sick for the kit, I'm assuming?
Yes, what's nice in the kit is there's a little card that says, like my slide, when you feel good, you do the daily, but when you feel something coming, you do the daytime boost and the nighttime boost. It's 3 twice daily and then 2 at bedtime. But having that boost and what's in the boost gives them confidence and you confidence. You're proactive. I mean, as a primary care doctor, what else do I do? Well, you have the symptoms, I test you, and I tell you to lock in your house. That's not a very good solution to me. I don't know why we're not being proactive, giving everybody a daily maintenance supplement, teaching them lifestyle, nutrition, sleep habits, all of the good things we know in functional integrative medicine. Have them do all that with a good daily protection. Then when they get sick, have a secret weapon to boost it. It just makes sense. Because in medicine, we're not doing anything. We're telling them to just go quarantine. I think we can do better.
Fantastic. Thank you so much for spending the time with us this evening, Dr. Mark, and sharing your time and expertise. There's a ton of comments coming in to thanking you for the presentation and how brilliant you are. So thank you again. There's a few questions coming in also about locating the slides and the references. So we will actually be sending a copy of the slide deck with the notes that have all of the references that Dr. Menolascino spoke of this evening. And you can place an order for the autoimmune defense kits. You can go to protectwellness.com and purchase through there. If you already have a CareWell dispensary, you're more than welcome to add it to your CareWell dispensary to drive sales that way. If you have any questions, you can reach out to us directly. Thank you so much for taking the time to join us this evening, and we'll be sending you the recording shortly.